Have you ever looked at an ECG and wondered what all those waves and lines actually mean? An ECG, or electrocardiogram, records the electrical activity of your heart. Today, we'll learn a simple way to read one step by step. Welcome back to Heart Lifelines. 1. Heart rate first. Check the heart rate. For a regular rhythm, you can use the quick formula, 300 divided by the number of large boxes between two R waves. For example, 4 large boxes would give you about 75 beats per minute. A typical resting adult heart rate is around ** 60 to 100 beats per minute. 2. Rhythm next. Check the rhythm. Look at the spacing between the R waves. If they're evenly spaced, the rhythm is regular. If the spacing changes, it may be irregular. Then check whether a P wave comes before each QRS complex. In normal sinus rhythm, P waves are followed by QRS complexes in a consistent pattern. 3. P waves and PR interval. Now look at the P waves. Are they present and consistent? Then measure the PR interval, from the beginning of the P wave to the beginning of the QRS complex. A typical PR interval is about 0.12 to 0.20 seconds. Changes in the PR interval can indicate abnormalities in electrical conduction. 4. QRS complex. Next, examine the QRS complex. The QRS represents ventricular depolarization. Normally, it's less than 0.12 seconds, or 3 small boxes. A wide QRS can occur with certain conduction problems or ventricular rhythms. 5. ST segment and T waves. Now examine the ST segment and T waves. The ST segment normally stays close to the baseline. ST segment elevation or depression can be significant, especially when combined with symptoms and changes in specific ECG leads. The T wave represents ventricular repolarization. T wave abnormalities can have several causes, including ischemia, electrolyte problems, medications, and other heart conditions. 6. QT interval. Finally, check the QT interval. Because it changes with heart rate, doctors often look at the QTC, or corrected QT. A prolonged QTC can increase the risk of certain abnormal heart rhythms. Let's recap so remember. Rate, rhythm, P waves, PR interval, QRS, ST segment and T waves, QT interval. This systematic approach can make an ECG much easier to understand. However, ECG interpretation requires proper training, and a real ECG should be evaluated by a qualified healthcare professional. Thank you for watching Heart Lifelines. We'll see you in the next video.